in, if you could just in thanks, Tahmid. As you come in, if you can just in the chat say your name and the organization you represent. We're gonna get started shortly. I don't want to keep anyone waiting, but if you can just in the chat say um morning everybody, say your name and the organization you represent, and we'll get started. Just giving everyone a minute or two to join. Right. Morning, everybody. All right. I think now's a good moment for us to start. If you haven't, please could I ask that everybody mute their sound and switch off their camera. It just helps with um, managing kind of background noise. So please mute yourself as you come in, switch off your camera. There'll be an opportunity to, if you would like to ask a question, we'll ask you to unmute yourself. But for now, please mute yourself. So, good morning, everyone. My name is Rimbi Gergens, and I am the User Engagement Lead for Data Drive 2030. We're pleased to have you joining us for the second in our series of webinars, in which we will explore the experiences of early learning programs and practitioners who have engaged with and used the ELOM set of tools. So Data Drive has started hosting these ELOM in practice webinars once every month or so, um, as a response to the request made by you, our community of users, for more touch points and more engagements throughout the year, rather than just the once a quarter community of practice meetings. So approximately once a month or every 6 weeks, we hope to gather online as a community to hear from colleagues who have completed ELOM studies. We want to provide a forum for users to learn from each other and to share their findings within the sector and continue to enrich the broader ECD ecosystem. So thank you so much for being here. It means a great deal to us that you are participating in this community and are sharing and learning together. Today's webinar is particularly special because it's about first-time users. So some of you who are here might be considering ELOM. You might be curious about Data Drive. You might want to know what this is that you've heard about. And today you will be hearing from two users, two organizations who conducted ELOM studies for the first time last year, and they will be telling you about what they learned and what their experiences were like. We've got from Breadline Africa, Nyaradzo Mutanha, and from Lulamaphiko, Lynn Stefano. They'll be sharing more about what it was like to use ELOM tools for the first time, the steep learning curve required by data collection, and the unanticipated pitfalls and difficulties of fieldwork, and what they wish they knew before they set out to do their ELOM studies. We're going to have time for each of them to present. I ask you to please just hold your questions until after the presentation. We'll give a little bit of time to ask questions after each and then have a bigger discussion. But in order to assist us with timekeeping, if you can just hold your questions, please. Please write them in the chat. What we'll do is once we've kind of gone through a presentation, we'll go through the questions that are in the chat and we'll bring them up. But when I say hold them, I mean please don't unmute yourself and ask while someone is in the process of speaking. So some housekeeping. If you haven't, please mute yourself, switch off your camera. I think everyone has done that. Please note that we are recording this session for the purposes of sharing with the broader community. We will also be posting a Google form, an evaluation form link in the chat. I'm going to ask one of my colleagues to post it now and then repost it again at the end of the session. Please give us feedback if you can. We'd really love to keep improving these webinars and keep kind of running topics that are of interest and use to the work that you're doing. Okay, so without further ado, I'd like to introduce Nyaradzo Mutanha from Breadline Africa. Breadline Africa is a non-profit organization dedicated to creating sustainable impact through educational infrastructure and collaboration. Nyaradzo is Breadline's MERL specialist. She brings over a decade of expertise in socio development gained from her diverse experience working with organizations in South Africa. Welcome, Nyaradzo, and welcome, Breadline. Over to you.
Thank you. Good morning, everyone. I'm just going to try and share my screen first before I start speaking. Okay, I'm going to put it in full presentation mode. Let me see if it works. Did it work? Great. So I'll just
Yes.
speak about ourselves. And also, it's important for us to kind of like share these lessons, right? I think like Rumbi said, they were full of surprises, but I think at the end of the day, just what we were able to achieve was very exciting. I also have a couple of colleagues from Breadline Africa within the room. They also assist with, answering questions if when you get there. But they were also part of the journey. We actually tried as an organization to make sure that everybody was part of the journey as we're doing this for the first time. So we've been in existence since 1993. We work in resource-constrained communities across South Africa at international level, but we actually known as the infrastructure guru within the education sector. But we also focus on pit toilets as well. And, for us to ensure that we deliver holistic services, we partner with different implementing partners at a national level. So we actually known in the ECD space, making sure that we cover all the domains, the 5 domains of the nurturing care framework, which includes your parental support, health and nutrition, safety and security, and also improving learning outcomes. I think also parental involvement and parental support is quite key because that's what we also picked up with, our experiences with ELOM. And we also ensure that our work is strategically aligned. I mentioned the nurturing care framework already, the DBE 2030 strategy, also the ECD 2030 strategy as well. And we've placed over 2,000 facilities at a national level. And with above 300,000 beneficiaries. And, using tools like ELOM allowed us to kind of like evaluate and enhance the quality of learning for young children in the sites. And considering that we're doing this for the first time as an organization, also trying to kind of like make sure that we place ourselves, we intentionally place ourselves as an organization that's going to be measuring impact and change as opposed to, just focusing on numbers and massification, but, actually caring for what happens inside the classroom. So, just looking at our samples, we did not do, like I mentioned, we are in all provinces South Africa, but we started with 4 provinces because we're using this as a dipstick. We also wanted to learn, also figure out if you're going to continue using ELOM, how are you going to do it? So to start with a small sample, but those 4 provinces, right? We also strategically or intentionally searched or looked for sites where we had like functional relationships with implementing partners so that we could get enough support. The tools that we used was the ELOM 4 and 5, the ELOM R2, LPQA, and the home learning environment. And obviously, in terms of just the contracting, took a bit of some time. But I think the last point there that I've got on the slide was quite key for us because, like I mentioned, we work with implementing partners. So it was also important that, we use the findings to actually learn together, engage with partners and provide them feedback in terms of like what the findings were. So you see that as I go through this presentation, I'm not going to speak about, the quantitative data or the qualitative data that came up, but I'm just going to be speaking about, the lessons that we learned because these are quite key and these are quite important also for the people that are organizations that are going to be using ELOM for the first time, right? So the reason why we did it, like I mentioned, we wanted to understand early learning progress beyond infrastructure inputs and support. So, we build a classroom, but we also want to understand what happens inside that building or that classroom. Also inform target interventions together with our implementing partners, a reality check, identify what challenges or barriers were there and responding to those, align our programs to the nurturing care framework, see where the gaps are, and also focusing on your child-centered assessments as well, looking at your emergent literacy and numeracy, gross and fine motor skills, and executive and cognitive functioning. And then adaptive management is quite important. I'm sure for those that have been in the monitoring evaluation space, for quite some time, I will understand that adaptive management is quite important because you need to adjust your programs and make sure that you're actually providing services that are required at a site level. And just in terms of the lessons themselves, we've picked up that there was a lot of time that was required for logistical coordination. So the lesson that we learned there was that you need to build enough project management capacity. So your project manager should not be managing; they can be managing other projects, but they need to have enough time and capacity to manage sites, right? Because some of the sites were not in Western Cape because we were based in Western Cape, but like I said, there were also other 3 provinces that were included. So making sure that you remotely manage that, you need to have capacity. And then resources, your tablets, your data, your transport, your accommodation, food, like small things that you overlook, like making sure that the assessors, they've got water and food and access to all the resources that they require, your budget. And it's also important to select assessors that are that would understand the culture and the local language and the area, and what also worked for us was that we had to pair them with local food workers beside, so it was easy for them to break the ice, especially with small children. That if a person is a stranger, an assessor is a stranger, they don't know them, they won't be as comfortable to speak as they should be. And it's also important for you to understand the tools yourself before use. So all those numerous engagements with data drive were quite important to us, and also resolving problems as they come. And WhatsApp is a powerful tool. I've seen WhatsApp is a tool that you can actually use for communication, for collecting data, and for making sure that you actually, even though you're not on site, but you're able to remotely manage sites, because you can speak to, we had all the assessors in one chat, and it was easy for them to share, or to also share lessons as they go. And selecting tools that are linked to the program aim itself. So we're also particularly interested in the LPQA now, and making sure that we internally train our field researchers to be able to empower them, to capacitate them to use that tool. So we learned to adapt quickly in the field and build internal systems for rapid feedback loops, and also it was an opportunity for us to enhance our storytelling skills as well. In terms of what we changed, making sure that there's tailored support to centers with low scores. So like I mentioned, after that, we sat down with our implementing partners per site, looked thoroughly at the findings, the quantitative data that was coming from there, and we started sharing work plans and signing contracts and MOUs, and also making sure that we actually share data as well, because sharing data is quite important, right? As much as secondary data, but you also don't want to go to the same sites and collect the same data that the partner is collecting, because you might cause research fatigue, right? I spoke about LPQ already, and adjusting partner engagements and strategies based on the ELOM scores, and making sure that our ELOM findings are actually integrated into our annual development planning. And then in terms of the enablers and challenges, I'm sure you could also pick them up as I was going, but then we picked up experienced assessors, so it was just easy for them to hit the ground running. And I also mentioned about supportive site partners and teams that were committed, field teams that were committed to actually the work and that understood the ECD sector itself. And just on the downside, it was admin heavy, took a bit of our time, but it was worth it. And also, understanding and repackaging complex data into slides, into digestible formats, so that our partners and also internally, as an organization, our colleagues would understand what we're on about and what the findings were about. So partner buy-in is crucial. we had strong relationships, and implementation went smoother. Where we had strong relationships, the implementation was smoother. And then, like I said, internally we had to grow our storytelling techniques and data use skills. Like, you just don't shelf data, you get findings, you ensure that you use those findings. So our advice would be, when you start working on ELO, make sure that you've got a clear learning agenda. Make sure that you actually understand what your objectives are and what you want to achieve. And it's also important for you to select tools that directly link or align to your program objectives. You use the findings, don't shelf them. It's important that you use the findings and be ready to listen and act on tough feedback. So it's not about having perfect tools, but it's also about using the data that you get to drive change within the communities. So our aha moment was, we saw that children actually thrived in sites where implementing partners had consistent programs, work plans throughout the year. They would make sure that they give parental support, also training the ECD practitioners, sort of like that holistic approach, but making sure that it's sort of like it's implemented the whole year, not just like here and there. And parental involvement, including families, it actually multiplies the gains. So where the caregivers were involved, whether it's a gogo or it's a mother or it's an uncle, we saw that children thrived. I would like to stop my presentation and thank you for listening to me.
Thank you. Thanks so much, Nyaradzo. Thank you. I haven't seen any questions coming in for Nyaradzo in the chat. Are there any at this time? So, I mean, I have one for you that we might just kind of kick us off. Um, so I'm intrigued by this idea of building a narrative, and you used the full set of ELOM suite of tools to do that. What was the benefit of using all the tools at once, and what were some of the pitfalls of using all at once?
Okay, so the benefits was that we're able to get like a comprehensive picture. So be it from the parents, from the ECD practitioners themselves, and the children, also the learning environment, right? So it's sort of like, as a first-time user, it gave us like a whole picture of what was happening per site, right? So it was not just like one-sided where you just focus on child assessment, that's about it. But we also had to get experiences even from the parents, because the parents would then represent your surrounding communities, right? And then the downside was that the reports were massive, right? When we received the reports, we're looking at them and saying we actually need to create space
Yes.
and time for us to go through them and make sure that we actually understand the reports from data drive ourselves before we even start repackaging and interpreting them for internal use, for internal colleagues, and also for externally. So it was just like that time that we needed to ensure that we understand all these massive reports, because when we got the reports, we put them per site. It was not like, it was like each specific site had its own report. So it was like massive.
Okay. There's a question from Nomsa. Nomsa, would you like to ask your question? Feel free to unmute yourself.
Yeah, no, thanks, Nyaradzo, for your presentation. I just wanted to get clarity because I'm a little bit confused because of the terminology. When you talk about implementing partners, who specifically are you referring to?
So we do have a different, so per site, we do have partners that are there. For instance, in Diepsloot, we had Hope Worldwide. So partners that are working in the ECD space that are providing different services. So we do have like different partners per site, because like I said, we provide infrastructure, but then in terms of like teacher, educator training, ECD practitioner training, I think that's the correct word, parental involvement, nutrition. Some sites we also have like partners that are offering nutrition support. So all those different partners within the ECD space are the ones that I'm referring to as implementing partners.
Okay, all right, thank you.
Thank you. I do see there's another question, but I think what I want to do now is if we can move on to Lulamaphiko, because these are questions that are going to be useful for them to answer as well. So please keep noting your questions in the chat. We are keeping an eye on that. But for now, I'd like to introduce Lynn Stefano from Lulamaphiko. Lulamaphiko trains, equips, and mentors parents, ECD practitioners, and foundation phase educators to enrich the lives of young children. Lynn is the founding director. Her deepest interest has been to create environments where people have agency and where local knowledge and external expertise work together for the good of communities and children. Lynn, I would like to give you the floor.
Thank you so much. I'm just going to get my PowerPoint up. There we go. Let me know when it's loaded on your side. There we go. Is that good?
That's perfect. We see it.
Okay, great. Hello, everyone. Lovely to be here. So I think you know a little bit about me, Lynn Stefano. Just Lulamaphiko works in northern KZN on the border of Eswatini and Mozambique. So we're about 5 hours from Durban. And you've heard about who we work with. We focus on early childhood development, early language and literacy up to in the foundation phase, as well as very early years and from babies, and also food gardens and nutrition program that we have. So we support about 180 ELPs at the moment, and we reach over 8,000 children in these 2 municipalities. And yeah, so just in terms of our actual study, sorry, I just want to move because I can't see everything. I want to move the banners. Yeah, so in terms of our study, I just wanted to tell you, or our assessment, I just want to tell you a bit about that, but really going to focus on what we learned from it as a first-time user. So we did the ELOM 4 and 5 year assessment with the 5 different domains that Data Drive assesses, and we added the socio-emotional functioning and height for age tools as well. We did the assessments over 10 days in November 2023 in 8 ELPs in deep rural communities in Pongola, which is Zululand, and in Quintile 1 areas. And we had a sample of 31 children. Our ELOM assessor is in the photo on the left with our driver. She, as I say, she went out for about 10 days to centres. So why did we choose ELOM? Lulamaphiko is contracted by the Do More Foundation to implement a basket of services for their young child program in Pongola. And Do More Foundation wanted to understand the developmental performance on the ELOM of 4 and 5 year olds who were enrolled in early learning programs in that municipality that we support in various ways. And we decided to do a dipstick study. So it was a once-off study at the end of the school year. And why ELOM? Because really we believe that it's seen as the gold standard, particularly because it's a locally relevant, reliable tool to use. So I'm not going to go into our results because that's not the purpose of this meeting, but we did have it was very helpful to get the results that we did very well in certain areas, and then there were some red flags in others, and we've been able to take steps to make improvements since then based on the reports. But yeah, that's not for today. I think what we really want to focus on is what we learned through the process, and so as a first-time user. So what I'd say is what we found really helpful is just to talk to the Data Drive team and to others who've used ELOM. So get as much as information about what's worked for other people, what Data Drive's ideas are and their methods are and so on, and really get advice and guidance from them. And we found that extremely helpful. I also spent a lot of time on the website. I just immersed myself in all the tools and the steps, and it really, I think, as has been described by Breadline, it's a project. It takes time. This is not a rushed process that you can go in as a first-time user. There's a lot to learn. Things are very nuanced and quite not complicated, but there's a lot to take on board. I think one of the things I would say was to really be clear about why one is doing the assessment and what data you're wanting. And I don't think this is a linear process. I think that we had an idea what we wanted, but actually through these engagements and looking at the website, that became much clearer. So I think it's a kind of a cyclical process that you work in. The other thing that for me as a first-time user that was really of concern to me was to have an assessor that I felt confident in. It was very important. I wanted to know that we had an assessor who understood children, who understood the tools. And so I did put quite a lot of attention into that. And then the other thing that I felt that I learned through the process was that I didn't actually understand the age ranges really well. I used the age calculator on the Data Drive website, and we did select the sample quite carefully, but actually when we got our results, we found that we had more 5-year-olds than 4-year-olds, and I still don't know how that happened, but I thought that we'd been really careful around that. So I'm just saying that was something that I noted. And then when we got our results, I went back to the Data Drive team and we did quite a lot of in-depth discussion about that. So all of those things I think were really helpful in terms of the process. In terms of our community engagement and feedback, I think this was really an important part of the process for us. Before we did the assessments, we did a planning workshop with the 8 ECD principals that we were working with. They came to a workshop with us. They brought all their documents, their registers, etc., and we were able to talk to them about the purpose of the study, lay any fears about them being scrutinized or assessed personally in any way, their standards. And explain that we weren't looking for the best children. I think that's always an issue. People want to have their best children assessed so that it reflects well on them. And also for them to understand that this was a general assessment to get a broad understanding of the performance of children generally in Pongola, not specifically to their ECD centers. So that it was a really important sort of foundational workshop that we did with them. And during that workshop, we also were able to identify children that fitted in the right age range and then do a random sampling. And one of the big keys was to actually be sure that children would be at the centers because it was November and often children aren't there at that time of year. So that isn't a good time really to do an assessment, but we had to do it then. During the assessments, I was in Pongola and I've met with the assessor every evening and I just made sure that we were on track. We went onto the website and loaded everything and she showed me the tool in detail. So I had a very good idea of what she was doing, which I was really pleased about. Once we'd got our results, I spoke to Data Drive and Linda Bierstierker, who, as some of you may know, helped develop the tool. And works with the Do More Foundation. So I spoke to her about the key information from the report to share with the ECD forum. So as I said, we have, in Pongola, we have about 120 or 115 ECD centers that work with us currently. And so we wanted to give the whole forum feedback on the results. So what we decided to do was to get Lulamaphiko back. So the assessor came back because we felt that she developed a relationship with the 8 centers. She had a good sense of the community. And we felt that she would be really good to be able to present the information back, the results back to the forum. And really it was a wonderful, it was received really well. We have a forum meeting every month in Pongola in 3 different locations. And so we had 75 practitioners attended or principals attended so that they could get feedback on the results. And then what happened, which we were really thrilled about, is that practitioners were starting to share in that forum the kinds of things that they were doing that they felt produced good results, and then also the things that they shared ideas of what they could do to address some of the red flags. So we felt it was a really good learning space and it was definitely worth the investment to bring her back. This is just how we used the results. I'm not going to cover that. Just in closing, enablers. I think the enablers really for us were that the Do More Foundation was totally committed to doing this. They commissioned it, they financed the assessments, so a lot of support from them. I think data drives availability, the information resources just always available to give guidance. I think I spoke a lot to Elizabeth at the time. Also, our team at Lulamaphiko, we're very passionate about learning and improving what we do. So we were all on board. And then also the ECD workforce really bought into the process. So it worked really well. I think the challenges for me, it wasn't so much that it was a challenge to find a skilled assessor, but it was a concern. I think you've already seen that. I was really concerned to get a good assessor, and Data Drive do have a list of assessors on their website, and they can talk more about that. But yeah, that was an important factor for me. I think a challenge was really getting my head around all the elements and the processes. I mean, there's a lot, it's very nuanced. There's a lot of information and there's steps to be taken. It really is like managing a project. And you really have to give it the time that it needs. And then I just think one of the challenges for a small NGO like ourselves, sorry about that, my finger's slipping, is that it is actually quite a costly exercise if you are using external assessors. And in our case, we were 5 hours from where the assessor lived. And so there was accommodation costs and travel costs, it's food and so on. So that all added up to the cost. So it does get a bit costly. So, but yeah, and I think the last thing I would just say is that I thought that I'd got the age ranges correct, and I didn't. So that was interesting for me, and I wish I'd understood more about that. But there you go. Thank you.
Thank you so much. Thank you, Lynn. Thank you for sharing that with us and sharing your learnings. We've had a few questions in the chat, so I'm going to go to those. There's a question from Fiona. Fiona, I wonder if you would unmute yourself and ask your question.
Thank you. Yes, I'm really interested in very practically. Lynn just talked about the way that the assessor was used, for instance, to give feedback to the ECD centre managers and practitioners. But generally, when kind of delivering results from the ELOM, I think people are always really interested, but also can get worried about what the results are saying, and sometimes may not fully understand the implications of them unless it's kind of couched in, well, right language in both senses of the word, the appropriate local language, but also terms that will be sensitive to people, but also helpful. And then there's the kind of ensuring that they're given support as well to implement any changes that are needed. So I'm really curious about the very practical steps that can be taken to ensure that our first speaker, we heard very clearly that these results shouldn't be shelved, they should be used. And so I think that's so important. So it'd be great to hear more about how to do that.
So I did have a slide on that, and you will have access to this presentation if you want it later. But we definitely took steps around that in what we provided. So through the forum meeting, one of the things we did was we hand out many book dash books. We get thousands of book dash books donated to us every year. And what we did was we developed materials for parents and practitioners around the maths and numeracy domains, which were very low. And so we did workshops with them. So that's just one example. Children got books to take home. Parents were trained in how they could engage with their children, but all around numeracy, all the maths domain issues that had come up. So that was one. We had a number of other things that we've done, yeah. But I think, Fiona, I'm not sure, you're saying, also it's about the language and how you present the data. And I think that's why we chose Pumla, because she has been doing this for a long time and she understands the challenges. I mean, people are very concerned that their work has been assessed. And so we went in it first of all and spoke about all the things that they are really doing well and acknowledged them for what they've done well. And for instance, literacy is one of the main areas of our work, and they did very well in the literacy domain. So we could acknowledge them for that and say, well done on doing such excellent work here. You're really showing. But we can see that we could actually support you more in other domains. And then we spoke about that. And what was exciting for us was to hear from some practitioners sharing with others what they do in those other domains. I think that to me was one of the exciting developments, is creating space for the practitioners to share, so that it's not always that we come in as external providers and saying that we have all the answers, because actually people, collectively people have a lot that they can share.
Thanks, Lynn. Before we move on to the next question, Nyaradzo, I just wanted to check, do you have any input on this particular issue about sharing your results?
Yeah. I think I also spoke about it when I was presenting, but I think this is quite key, because when we say that, we must not show off data, we actually talking about sharing the findings and actually knowledge, because that's how we're going to promote the use of this data. Also how I think what's important is how do you package it. I think maybe one of the questions that Rumpi that you're gonna ask that I've also seen in the chat is about how do you communicate positive and negative findings, right? Like how do you package it? So you package it in a way that you're not playing the blame game. We're not saying that. We're actually saying that we're identifying that they are acknowledging that there are systemic challenges within the ECD space. DB also knows all these partners that are working in the ECD space, they know, because if you're on the ground, you actually understand what's happening, right? So it's not anybody's fault, but what can we do collectively to ensure that we strengthen systems and we actually respond to what is needed on the ground. So if you package it like that way, that the scores are low, we're not saying you do not do well in terms of this, but we're saying that this is the reality. What systemic challenges are there? What can we do collectively as organizations working within the ECD space to ensure that we respond to those? And I think there was also a message that I also saw, I think, a question about making sure that we work collectively to ensure that we reduce research fatigue. So I think it's really important that if you're in the same site, in the same ECD center, you actually need to speak to each other. If you compare public health, like what happens within the public health sector, Department of Health and all these implementing organizations within the same space, they actually have like quarterly meetings in this. They meet regularly and they speak about challenges and making sure that they don't double count and all these things. So I think in the ECD space, this is where we're actually supposed to be moving towards, making sure that we share data, we share the results, we share findings, because if we do that, we actually reduce research fatigue in these sites. Thank you.
Thanks, Nyaradzo. I think that speaks to the question from Petang about avoiding research fatigue, that it's really important to know the context in which you work and know who else is in those spaces. And I think Nyaradzo, you mentioned working with other organizations like Hope Worldwide, you mentioned. So you know that you're not the only operator in a space, and you're communicating with one another within those geographies about the work that you're doing. There's a hand that's been raised. Linky Nkuna. Linky, would you like to ask your question?
Yes, greetings all. I wanted to find out, Lynn mentioned a community engagement workshop and also a forum meeting. So I wanted to find out who was part of that, of the forum and these workshops, because we are planning to sort of like do the ELOM as well. So just to understand, like, who are the stakeholders that needs to be involved and engaged on the ground? So outside of the center managers and the practitioners, who else should we be talking to and making sure we are including in the process? Thank you.
Thanks, Linky.
So I would say that DBE would be really important to engage with, so that they are clear about what research, assessments or research you're doing in the communities or in the centers. I think that's a really key stakeholder that you need to work with. But from our point of view, what we did was we brought together, when I say community engagement, we brought together the actual the principals and the practitioners to plan together. And I think that planning together was really important. I think it's also very useful to go back, for instance, in KZN, we have what are called war rooms that are run by the local communities. And it's useful to go back to those war rooms, for instance, with practitioners. You can do that as a support if you're an RTO, or ask practitioners to encourage practitioners to do that, but actually to give feedback back into the community to let them know the kinds of results you're getting. So I think those kinds of engagements are really, really important. The forum is made up of all the ECD centres that choose to join the forum. And I think it's really valuable to have, so that you don't just give the feedback to those that were assessed, but actually to the whole forum, the whole body of ECD practitioners that are in the area. So, yeah.
Thank you,
very
Lynn.
much.
Thanks. Thanks, Linky. We've had a question from Morris Ngwenyama, also from Singita Lohfeldt, about the relationship between the National Curriculum Framework and what we assess in the child outcome assessments. And I'm going to ask my colleague Liz to answer that, as she was critical in part of developing these tools. So Liz can speak to that. Liz?
I was going to ask Linda to put here so we could hear her voice, but I'm absolutely
I didn't
happy,
want to put
Morris.
Linda on the spot, but
No,
go for
absolutely.
it.
Morris, it's lovely to get your question. All the ELOM tools, now the learning program quality assessment tool talks to the elders based in the NCF, and the ELOM 4 and 5 years assessment, the child outcomes assessment, is fundamentally based on the South African curriculum framework. So yes, it speaks to it very closely. The ELOM R tool, which is a tool for looking at kids in grade R, fundamentally speaks to the South African curriculum, the DBE curriculum as well. And so that's a very, very interesting point, and it's one of the reasons why the tools are relevant to the local context. We've got some interesting projects at the moment where different countries are wanting a similar child assessment tool, but working with their curriculum. For example, in Eswatini, what does the Eswatini curriculum require? What are the elements of that are important, and are these tools measuring that? What do we need to adapt to make sure it's contextually relevant? Linda, do you want to add anything else?
Thanks, Liz.
Hello, Morris. And hello, Linky. I haven't seen you about for a long time. It's nice to see you back. I think just to say that while the learning program assessment covers very strongly all the principles behind the National Curriculum Framework and the key curriculum things, the early learning outcome thing had to be a little bit more abbreviated. We couldn't put children through a very long assessment. So we did align with the National Early Learning Development Standards on which the NCF is based. We also, though, looked at the things in that most strongly predict later school performance. And it was the same when we looked at the grade R caps and had a look at that, so that children were not assessed for more than 40 minutes, which is a long time for a child of this age. Thank you.
Thank you, Linda. I want to ask a question, if I may, about assessors. So I know, Lynn, you said it was very important that you contracted with an assessor that you trusted, and that role became extended beyond just the data collection. Nyaradzo, I want to ask you to speak a little bit about your process of working with assessors. What were the challenges? What was required in coordinating assessors? What were you looking for in your assessors? Because I think your experience would have been different. You had a broader sample and a wider range of tools that you used.
Okay, thank you for the question. Yeah, I'll respond. I think for us, the first the advantage was that the first due diligence was obviously done by Data Drive because we picked these assessors on the Data Drive platform, right? So it was easy. So just in terms of the interviews, we had to ensure that, because they need to just say that they're in Limpopo, right? And then in Limpopo, you've got like a specific area, so there was quite a few misses with the interviews because proximity was quite important because, you want to be on site at the ECD center on time because you also want to give the kids time to sleep and eat and play and do. So all the activities were needed to be completed in the morning, right? And then also, what was also important, like I think what I mentioned in my slides was making sure that they are culturally fit. Obviously it's a requirement that they should be speaking the vernacular or the local language, but also for them to just fit into the communities. So the closer they were to that community, it was better because then they would understand all the community dynamics, right? And I think the huge advantage that we had is what I've already mentioned, that we had to pair them with local food workers or researchers employed by the local partner that we're working with. So for introductions, making sure that they, the children are relaxed, and it was easy for them to break the ice using that, and also making sure that we take care of the assessors, right? Make sure that they've got accommodation if they're a bit far from the site, and if they, also transport, because some of them don't have cars, because it was also at a time where the Thrive by 5 assessment was also running the time that we were running ours. So that was a bit of a clash, and making sure that we are not in the same size with Thrive by 5 assessment to ensure that there's no research fatigue. And, because we had said that we've actually spoken to Data Drive and said that, we need to know where exactly Thrive by 5 is and where are we, so that we don't clash. And, it's also important to kind of like share results. Because obviously, when we do the assessments, when we go to the reports, there was also a comparison to the Thrive by 5 thresholds as well. So it was easy for us to see where we're going, so how we're doing in our site. So I think, those were some of the lessons that we learned with field researchers, but it was important to ensure that, this is a human being that you're working with, right? So make sure that they're well taken care of so that they can actually take care of the children in the sites.
Thank you. You've mentioned Thrive by 5. It's something that many of us in the ecosystem are aware of, but I want to ask Lynn, if you can jump in here and just say what seeing the Thrive by 5 comparison in your report, what kind of perspective it gives, and what users can expect to learn from that part of the report.
Sorry about that.
No,
So I found it very helpful to have the comparisons in our report because it gave us, I think there were some concerns that I had about the low scores in certain domains like social emotional relationships, the maths and numeracy, but actually looking at the other results from different parts of the country, also from other rural areas that were similar to ours, it actually was somewhat reassuring that our results weren't so terrible, that actually these were sort of quite often very similar results. And so that was really helpful to be able to see that. And then in terms of the good results that we found, it was really good to be able to see that where we had put a lot of work in around early literacy, etc., that actually our scores were quite a lot higher than the other scores. So it really does help to have that kind of comparison through these results that we get. It guides the work that one can plan for the future, can guide one's programs. So I don't know if that answers what you were asking exactly, Rumbi. And I did want to ask you though that I don't know if there's anyone on the Data Drive team, because I'm making such a big point about assessors. I don't know if there is someone on the Data Drive team who would like to say a little bit about the assessors that your system of highlighting which assessors are available in different areas and so on. But that was just a question I had for the Data Drive team.
Thanks, Lynn. So one of the cornerstones, one of the principles of the child assessment tool is the home language administration, so that the assessor needs to speak the home language of the child. And for that reason, we have to be geographically spread around. So there is, through the training and through accreditation and through refreshing and through that whole process, a process whereby assessors are put on the portal and they're part of our database. And then you can actually just search, depending on what language, your first priority would be the home language of the children that you know need to be assessed. There has been over the years a need for more indicators, not just the language of the assessor. We also want to know, where do they live, And so then we have to get POPI compliance to be able to share that personal information. Then we want to know, okay, not just where we live, but how many projects have they ever done, So then we have to kind of make sure that we've got the compliance to be able to say, well, this person has done a number of projects and things like that. And then so recently we've also received input on, like, well, I would like to know how good that assessor is. And that is a very difficult, you can imagine, very difficult thing to kind of give information on. But what we've introduced last year, or was it the year before, is a process whereby fieldwork managers, after a fieldwork experience with an assessor, can actually rate them on their professionalism, on their on all their kind of levels of responsibility and thing. And we have a kind of rating score. At the moment, it's still biased towards those who've had a rating. So those who've had recent experience or recent assessment experience and therefore have been rated, because some people still haven't had that and haven't been rated. But that's just one extra element where we try and give some sort of indication of who is who. But it's in an exact science. And in no way, I've said this before, are we a labor broker, but we are responsible. We take very seriously the quality of the data that comes out. Is an incredibly important part of what Data Drive does. Kimon's got a question that actually speaks to the same thing. If an assessor has proved to be unreliable or have done a poor job, do you remove them from the database? Kimon, yes. It's a big part of the assessor management, and we've taken far more responsibility for that over the last few months, actually, or last year, in that process. So yes, they do get removed completely. Rumbi, welcome back. I know Jessica had a question. So
Thank
Jessica,
you. I'm so sorry about that.
No,
Thanks,
Jess,
Liz.
over to you.
Thanks, Liz. Just a question I have for the two of you is that obviously new users tend to or can be quite overwhelmed by the amount of capacity that's needed internally to manage fieldwork. And often this hasn't necessarily been kind of budgeted for in the human resource sense. So I just wanted to know if you could speak to what sort of capacity is needed and what have you learned for the next time you have to manage fieldwork.
Can go first. Yeah, so I think initially when we were engaging with Data Drive, we were actually informed that it's going to be admin heavy, but we actually underestimated that statement. We thought that, it's just assessors getting on site and, getting these assessments done and they're out, right? So when we actually picked up, I think when the first site was actually going, we actually picked up that it's actually going to be admin heavy because we kept adding sites per different province. It was hectic. So we had to go back to the drawing board internally and just look at our capacity and then within the team. And then I was actually nominated to just focus on ELOM, especially during the time that we're having these assessments, because, you can have different issues popping up in different sites and all these, especially if these assessments are running at the same time. So we had to sort of like deprioritize our tasks internally and just focus on that, make sure that we complete, because also ensuring that we've got quality data and the assessors are fully supported was important. So, and also, just having the partners that I mentioned earlier on site, just to give additional support where it was needed. But because it was a Breadline Africa assessment that we're leading, we actually had to be on the forefront of everything that was happening per site. So we had to sort of like deprioritize and make sure that, we put our efforts there. Thank you.
Okay, and from our side, just remember we only had 31 children that we were assessing in 8 centres, so we had a very small study. and it took 10 days, as I mentioned. So we discussed with the assessor how many days she could, how many children she could do per site, and it was about 3. On it, I'm trying to remember now, actually maybe up to 5, a maximum of 5 on a day. And yeah, so in the beginning, my 2 team members and I did all the planning. We identified centers and communicated with them. During the assessment, I actually visited Pongola because I'm not based there, and spent about 5 days up there, and gave quite a bit of just support, and as I said, checking every day that things were on track. And we had a dedicated driver who knew exactly where to go. And yeah, so, and I think that was really it. So it wasn't very administrative heavy. I think the planning for me was really where a lot of my energy and attention really needed to be focused at the time. So once the assessor was working and she was very skilled, it was really just a matter of making sure that the process continued. But as I say, I think that's because it was a small assessment sample.
Thank you both. We are running out of time, as we always do. Fiona has a question about if there were any disagreements or surprises in the results, and if any of the centers or the implementing partners were surprised and were not in agreement with the results. If I can just very briefly ask you that, and then we'll have one last question from Linky, and then we'll wrap up.
Okay, I'll go first. I don't think people were surprised. I think they were a little bit dismayed. They would have liked their results to have been a bit better in certain domains, which was a good thing that they actually saw the results then, because then they were working with the facts of things. So I think that was good. And I just do think there is this sense of people being concerned about, are they meeting the standards? Are they being scrutinized? That is quite, and really having to manage that well, sort of working really in terms of encouraging people to see it as walking a journey together rather than coming to be assessed to see if you're performing well enough. Yeah.
I can go. I think we had one site that we kind of like surprised, especially with just the results on the child assessment level. You find motor skills, your gross motor skills, and all those kind of domains there. So because I think the greatest discomfort was in the fact that this was a dipstick, right? And it for them it looked like, because it's just sort of like a once off. Although we're going to do like follow ups later on, but they were just like they were like just some discomforts there, and then we had to manage it, right? Ourselves and the partner, because luckily the partner is actually willing to come on board and say, how do we work together? Because this is the results that are there. It is what it is. This is the quantitative data is telling us what we do. And then we actually said that since the discomfort lies in the fact that this is a once-off, to sort of like once-off to them, a dipstick, let's ensure that there's continuous monitoring, right? So there's that monitoring element and there's that evaluation element. So we said, let's look at our monitoring SOPs and our monitoring plans and what can we do together. So actually it also speaks to the point that I mentioned earlier on about making sure that you work collectively together, right? And then we ended up agreeing that there should be some regular assessments that are happening there. The partner is currently doing those, and how do we actually share the results to ensure that you kind of like make sure that they mirror to the ELOM findings, or how do you sort of like piggyback and make sure that we implement adaptive management and we support each other in changing those results. So that's how we approached it. And, at the end of the day, we agreed and with consensus.
Mm-hmm. Thank you. Thanks, Nyaradzo. Linky, your hand is up. Could you ask the last question and then we'll wrap up? I know we're running slightly over time.
Yes, thank you. So I just have one question and one request. May you please link me with Nyaradzo and Lynn? I would really love to pick their brains so that I can get a clearer picture of where we are wanting to go with ELOM. And then also,
Yeah.
I know Lynn spoke quite, I think, twice about the age range that she got it wrong. So, like, now I'm curious, like, I think this is more specifically to you. She mentioned a calculator. My network was up and down. I may have missed it. So, just to understand, what is that? How does that come
Okay.
about to not get the child's age right, so to say, so we
Okay.
understand? Thanks.
Okay. So, can I suggest, Lynn has already put her email in the chat. Nyaradzo, if you wouldn't mind just putting your email address in the chat as well. We will be, with permission, Nyaradzo and Lynn's permission, we'll share the slides. And the age calculator is a tool that we've developed that Data Drive uses. And I can definitely, as part of what we share, we can definitely link to that after the webinar. I'm very conscious of time. I know that we tend to kind of budget an hour for this and we always kind of run over. So I'm going to kind of bring this to a close. I want to thank you all for being here. We really appreciate this community. As I say, the users and our partners on the ground are really who make the data sets alive and who make sure that we're not just collecting numbers that, as Nyarazo said, sit on a shelf, but that are actually driving and informing change for the communities in which you work and for the children that you are dedicated to helping, serving. So our next ELOM in Practice webinar will be on the 18th of June. Please mark your calendars. And it's focused on embedding ELOM data into monitoring, evaluation, and learning. It'll be facilitated by Dr. Jess Haller, who is our MEL specialist at Data Drive 2030. You should receive an email. Keep an eye out on our socials for information on that, 18th of June. Please remember to complete the evaluation form. I'm going to ask, please post it in the chat. We really value your input and your feedback to be as interactive and as enriching as possible for you. So if you have any feedback on this webinar, any webinar ideas of things that you'd like to hear more about or talk about in these sessions, please let us have that feedback in the feedback form that Jess has linked to in the chat. Thank you so much. A very special thank you to Lynn and Lulamaphiko and Nyaradzo and Breadline Africa and both of your colleagues at Lulamaphiko and Breadline for being so open to share your experiences and for all of the time that you've put into this webinar. We really value it, your time and your input, and we're very grateful. Thank you, and thank you also to my colleagues at Data Drive. Yeah, thank you everyone for your time and your effort and for continuing to make the ECD ecosystem such a vibrant and collaborative space in which to work. So thank you.
Thank you. Bye.
Thank you. Bye-bye.
Thank you.